Dr. Scope, Dr. Michael Scope, who is the campus president, had the word we always use is impetus. It was his brainchild. We are actually doing this because he wanted to get the students involved in something that would positively impact the community. He set it to a couple classes to look around, as far as market research and see what services or products that the community needed the most and how we could go about, creating a business around that. And of course, it being a food desert and food being one of the most important things that you could provide for any kind of community, the food co-op was the first thing that they selected to do.
I think it also just says to people that, it's not just another business, just the thought process behind it, the co-op working together, a cooperative of people who otherwise see businesses every day and come in, set up shop, and take the money and don't really leave anything behind. And so I think just the social aspect of it, it just says that, we have something more to offer everyone, including ourselves. It's a give and take type of relationship.
I think another part of the co-op was just in its structure. It's community-based. It's about people coming together, and it's also the fact that you can do more because it allows for donations, volunteers.
A lot of people are excited about it. I think they're just still kind of hesitant at a certain point because it's something new. They really haven't had anything like this in the community, but from everything we heard, people are really excited about it.
It works like this. One of the things we wanted to do is access. So we decided that we would bring the food closer to the residents, as opposed to them going somewhere else out of their range, because access is a problem. So what we decided to do was to connect with businesses or community stakeholders where we could actually bring the food in as a distribution point where people around that area can come and pick it up. So from that, we decided that we had to implement a program to where they could purchase and then come back and pick it up. On the purchasing side, what we do is we create a list of available foods, and what the member consumer would do was get that list from one of the distribution points, which is right now Allenby's, 3400 Carnegie. They go in, see the order sheet, check off what they want, total it up, and pay. So once they pay, the order is sent electronically, or we come pick the order forms up, and then what we do is send that order form either in digital form or paper form to our purveyor, and they fulfill the order and deliver it at the distribution point where the consumer can come pick it up. So we make it so that it's accessible to people who have food stamps, EBT, debit, credit, check, cash. You can pay in any form and then come to that same location and pick it up.
Yeah, this was probably a few classes before ours, which was the implementation of a food co-op, when they actually did some research, the market research for the central community. And considering how much overhead it is to run a business, to pay the insurance, the lease, the electricity, the gas, and all of the other things that are a part of running a business, we figured that we would use the resources that already exist in the community. It's definitely a part of the co-op model, and it works because you have the resources of not only the community residents as far as human resources, but the resources of the other organizations and business who also have the same mission to see Central back to health again.
The co-op has pretty much impacted everything that I do, not only just at school, but just on a personal level. People know us, and they, a lot of times, students who go here, they'll say, well, I heard something about the co-op. I like to volunteer. How do I get involved in that? And so a lot of the things that I do is working with volunteers, bringing them in from Tri-C. A lot of the faculty and staff are always asking, what's going on with the co-op? How do I get involved? Or, you know, when are you guys going to have food here?
Dovetailing off of what Tamia was talking about in terms of school involvement, I think the other thing is creating business opportunities, because as a co-op, like Don said, we haven't figured everything out. There's other parts of the business that will grow as we grow, like distribution, maybe some restaurants that maybe source through us, get the food through us, maybe food carts or butchers. I mean, it's a continuum of businesses that could form and do business with us. So in terms of how we're involving students, we're also involving entrepreneurs. Say, okay, if you want to start a distribution company, then you come in, present, you know, your idea and how you can help us. Or we might put a RFP out and say we need this, we need that. And so we're trying to create business opportunities. So adding to whatever else the co-op does is also economic development.
Some of the highest rates in diabetes, hypertension, high blood pressure, heart disease, most of which are food related, you know, the way that people think about food. So our biggest issue that we've known from the beginning is changing the way that people see food. I've had the opportunity to talk to some of the residents in a few of the high rises, and you'll be surprised. I mean, the attitude is that there's nobody in this community that really knows anything about healthy food, and that's not true, especially with the older generations, because even if they have their own habits, when they start having children, grandchildren, it becomes more and more important when the children's attention span is at a certain rate. You know, they are the ones that are a little bit more conscientious. I had going to one, and we had probably a good 80 to 90% of those residents who were really eager to hear more, really eager to become a part of it. So now we're trying to meet that eagerness with, you know, the easiest steps to be a part of it. So
It was.
we had some plans where we want to teach classes, we want to develop a curriculum, and they already exist in the community.
Right.
Why recreate the wheel? You know.
We have nutrition, dietetics at Tri-C, and what they've offered to do was do some cooking classes. Like take the fresh vegetables and actually show you how you can use these fresh vegetables in your normal cooking. It's about taking what you already do, but just doing it a little bit healthier. You know, maybe take some of the salt out of it. I think that's, you know, me personally, you know, with my family, we eat healthy. I mean, we eat the right foods, but generationally, we probably use too much seasoning. So you kind of offsetting some of the good of eating fresh fruits and vegetables with the way you prepare it. So that's what these classes are about, to show you the ways that you can prepare the food, stuff that you normally eat, just in a different way, so that you benefit from it.
Let's go, Stroke.
Initially, I think our problem was that there wasn't an organization that aggregated all of the local farms so that we can say, hey, they're supplying that, they're supplying that, they're supplying that. So it's just a matter of taking your time and seeing what's available in the community, who's producing what's their capacity, what types of foods are they, and then you have the issue of seasonal foods, which, you know, we're year-round business, so we have to make sure that the suppliers that we have for one season are supplemented during the other season. And we have a couple in the community, and by the way, our first choice is always suppliers from the central community. So when Mr. Frank Kidd started building his nursery over here, and things started blooming, and pounds of food started coming off of the lot, we knew this is a guy who's been in this community for years. He has several businesses. He employs quite a few residents from this community. So we know that is what we want to partner with. And by the way, we would rather partner with someone who is cause-oriented rather than bottom-line oriented, because it's always where people matter that real success is. Entrepreneurship is one thing, but you can't build a city on infrastructure alone. You have to start with people, and that is one of the prime examples in the central community. There's also Mary Donnell and the Greenhouse Project, which is like 4.7 acres of what do you call it, greenhouses. They'll be supplying all types of lettuce and herbs and things like that. They may not have a large variety, but what they sell is so much of that you know, it takes one thing off of our list of products that we don't have to focus on anymore, and then try to figure out who serves this. So we're looking at maybe, hopefully, in the near future, having a good 60% of our stuff produced in the community, and where we can't find a vendor that produces the variety or the amount of what we need, we'll get it from the food terminal, which is also local. It's the company is local,
Right.
but most of the food comes
Food
from somewhere
supplies.
else.
Yeah.
And I don't have any problem with
Sure.
purchasing from other states. I guess the hardest part when we were trying to build a model that would work for this community is looking through all the co-ops that existed and seeing which ones would fit in the area, for the area need that we had. And, you know, there are urban farms, which are by far the most, and then there were the suburban, you know, farmers markets and co-ops that had all of the specialty items and the organic foods and the whole foods related industries, and nothing really was specific enough to deal with the needs and the inability to afford some of the things that are being produced.
Yeah.
And I guess we just really had to piece some things together, and that's why you won't see a model similar to it. And it's amazing. It's just we have to grow into some of the parts of the puzzle that, you know, that we have left on the table. But so far, I think that we're doing pretty good. You know.